Hi everybody, my name is Kate Patterson. I'm a Delos Therapist, and I'm here to talk to you about what it means to use your body as your instrument. This topic is really exciting for me because as a trained dancer for 15 years, I pursued a career in performance. My history includes primary training in hip hop with supplementary work in jazz, contemporary, and ballet. I taught at studios. I helped prep kids for competition, as well as live performances and stage work. One of the most exciting things that I got to do was dance for a season with the Denver Nuggets. I'm no longer pursuing performance work, but I do teach a weekly class in Chicago for adult movers. We had about 15 hours of classes and rehearsals per week. You have classes to keep up on your technique, and you also have maybe upwards of a 5-hour rehearsal to learn material, to change it. It's a lot of time and movement being put on your body, and I ended up finding that my hip mobility started decreasing, my lower back pain started getting worse. I remember that it started even like maybe about halfway through rehearsal, and then it started creeping earlier and earlier into the start of rehearsal. To one point, I remember it was maybe 30 minutes in and I was starting to feel aches and pains in my back, and I was having to stretch in the middle of rehearsal. So all that's really daunting, and so that's what prompted me to go out and search for answers. I was putting in maybe 15 hours a week training with a company, and my lower back and hip pain kept getting progressively worse. And I just really felt that I needed a plan for longevity for my body. And that's what prompted me to go to massage school to try to learn about how I could make that happen for myself. I briefly worked doing massage therapy for about 1.5 years, and then was introduced to Delos Therapy by a colleague of mine who explained to me this different approach to muscle tissue and to creating pliability. And of course, I didn't really understand fully what she was talking about until she brought me in for a session where she worked on my hips. The tissue felt really hard, it felt tight, felt fibrotic. It wasn't able to move for me during my training, and I noticed a big difference after even 2 sessions. And so that prompted me to continue searching for answers. Now, this therapy originated in the early 1980s by an engineer who was an athlete dealing with chronic pain and was really frustrated with the lack of results provided by conventional medicine. And what he did was he actually turned his body into an engineering project, where he found that by applying direct and systematic pressure directly into the tissues of his shoulder, that he was able to provide relief for himself and had a profound effect on his body. As both a teacher and a performer, I can't tell you how many times my students and my peers were out on account of an injury, or they're feeling like kind of this like constant ache and pain that they're maintaining with physical therapy or PT, or they're stretching. But everyone kind of, so many people just are maintaining a baseline of not optimal movement, right? So it's really frustrating to work through that. So what Delos Therapy can do is by reinstating pliability in the soft tissues of the body, is we can open up that movement for dancers or for any performing artists to allow you the capacity to work how you want to work and to continue to develop your craft. So I've got Eric here to help me demonstrate some therapy. A common ailment or common complaint that we see with dancers is tightness and discomfort in the outer or the lateral hip and leg. So Eric, I'm going to apply very direct pressure into your tissue, and I want you to tell me how it feels.
So it feels a little bit tender, and I can tell that the muscle is resistant to the pressure, but I also feel that the pressure is forcing it to stretch, which is very different than a massage, which more feels like it's gliding over the muscle.
Exactly. And what we're looking for is a point of resistance in the tissue. So you're exactly right, and that tissue feels tight, it feels hard. Once we reach that point of resistance, that's when it starts to feel sensitive. And what you'll notice over time, and as I continue to take passes through this tissue, is that the tissue will actually soften and it will become less sensitive. What that means is that the tissue is opening up, it's becoming more pliable, and we're starting to restructure it back into a healthy state. Go ahead and stagger your legs for me, please. So this is another important concept in our therapy. We take multi-directional pressure and we apply it into the areas that are the most tightly bound up. We find that this is the most effective way to create change in the muscle tissue.
And I feel like this orientation is loosening up and gaining access to muscle fibers that we didn't have access to in the other orientation.
Exactly. Are you feeling a difference in the pressure as I take more and more passes through?
I would say the sensitivity is decreasing. I feel like the tissue is softening.
So many of our clients will ask what they can do for themselves in between sessions. How can they help themselves after a hard workout, after a rehearsal? So we recommend using a variety of tools. We've got a gumdrop here, a knobble here. People will often use a tennis ball or a lacrosse ball as well. And you can essentially apply pressure yourself, working all the way through the line of tissue that feels tight and hard, and being sure to apply different angles is really important. As a dancer, I can't stress how important it is to maintain your body. Your body is your instrument. It allows you to put in the time to make your craft better and to create the way that you want to create, and that includes your movement. So thanks so much for joining, and we'll see you soon.